So self-introduction, I'll keep it short. I'm Dr. Janis Phelps. I'm a professor at the California Institute of Integral Studies in San Francisco, California, and we run a certificate program that I'll talk to you about, which is why I'm supposing you're here. That's for licensed professional and clergy to learn how to do FDA and EMA approved research of the future, because we'll need an inordinate number of therapists in the future should all things go well and psilocybin and MDMA get rescheduled and other psychedelic medicines thereafter, hopefully. So I'll take you into the presentation here. And as a good professor, I'm giving you an overview of the map of where we're going before we get there, so you'll know what's happening. So I'll be talking about why we created the program, who the instructors are, who the students are, the curriculum, and the outcome. We ran the program last year. It's an 8-month program, and we have a current group of students in it right now. Oops, wrong way. So the overview here is that the institute, the university that I work for, is a graduate university, and we train 250 to 300 therapists every year, graduate them, of course, at the master's and PhD level. So we were well poised to do this kind of work. And we're supporting the Renaissance that we're talking about in this wonderful conference this weekend. And we're doing it for people who I'll describe to you in a moment, who meet credentialing requirements. And it lasts for 180 hours. In the United States, the certificate, which is a postgraduate training program, often runs from 150 to 250 hours. I sliced it down the middle and did it at 180. And it takes place, as I mentioned before, over 8 months. And our institutional partners who helped us carve the curriculum is the Council on Spiritual Practices, which was convened by Bob Jesse. How many of you know about CSP? Some of you, a very prominent organization in the United States. And the Hefter Research Institute, many of whose researchers are presenting here this weekend. MAPS, several people from MAPS are presenting here this weekend, and the USONA Institute, which is now affiliating with the Hefter Research Institute to promote the phase 3 studies on psilocybin in the United States. So just backing up here, I'd like to give a shout out to all the help that we got from members of each of these organizations. And I'm really grateful that we have a collaboration of people representing these groups and CIIs. And these are the students. They're people whose titles perhaps are different in the EU and here in the UK, but I'm sure you have comparable sorts of mental health practitioners. We've didn't get any ordained or commissioned clergy or chaplains the first year, but we have 3 this year. We're very glad of that. Last year, it was all medical doctors and nurses and psychologists. And I'm sharing this with you because this is a context from which some of them came. The psychiatrist saying, listen, you've got to relax. The more you think about changing colors, the less chance you'll succeed. Shall we try the green background again? Some would say psychiatry and psychology have been a bit hampered, and you have heard that from other people before me. And I would say most of the people in my classes are just tired of even getting close to talking that way with their clients and feeling frustrated with inadequacy of many of the talking therapy methods that we have. So our learning objectives to help these folks reinvigorate their practice is to have them learn knowledge of research design, and that's knowledge of the designs that are being used currently. In the last 10 years or so, we're emphasizing to understand the science of the use of psychedelics in healing and therapy, knowing neuroscience and pharmacology, and a thank you to Dave Nichols as being one of the key teachers in that regard for these students. And to develop skills in psychotherapy, some of which have to be unlearned, as Roz Watts and others have shared with you in other sessions. It takes some unlearning of what we get taught as mainstream therapists to be a sitter or a guide for psychedelic sessions. And then to attain competence and a deep understanding about what safe set and setting is. And these are our teachers. I won't list them, talk about them all. You can just see these are superstars in the field, primarily from the United States right now, but part of my reason for coming here is I'm getting to meet your well-esteemed therapists who are here at the conference and hope to have them teach with us in the fall. And all 201, I would say, of our students and our teachers have had some sense of what Rilke's talking about here. And it's part of our admission criteria that they have some sense of spiritual practice and a sense of mystical experience of their own, of whatever type they might have had in their lifetime through yoga practice, meditation, and theogenic practices, fasting, wilderness trips. Not to be cut off, not through the slightest partitions, shut out from the law of the stars, the inner, what is it? If not the intensified sky, hurled through with birds and deep with the winds of homecoming. The inner, what is it? If not the intensified sky, hurled through with birds and deep with the winds of homecoming. We want people who've had some sense of presence within them that stitch of a poem points to, because those are the people who will be able to thread their way through a full session of all the ups and downs that people can go through. We also are very committed to increasing the diversity among therapists in the field. As I just look out at us, we look very similar. We need to diversify ourselves. So we were looking for military vets. We are looking for people who identify as LGBTQI or people of color. We're looking for more women. And we're also looking for people who serve marginalized or underserved populations, because we know those people will be the ones to help advocate for access of the medications once they get rescheduled. There's some concern that only the wealthy may be able to afford these if insurance is not covering it substantially, which hopefully will be amended before the rescheduling happens. And this is the demographics of our folks. I just wanted you to see who is in the program. This is for 2 years worth, where we've trained 41 last year and we're training 48 this year. So we had a nice diversity with people of color and people who identify as LGBTQI. And this is the curriculum. I base this on my own understanding as a clinical psychologist of set and setting and my own research in this field over decades, and then put this out to our consultants, and we honed the modules down to this. And I'll go through each of them with you. This first one, Research Foundations, as you can see, we cover the pharmacology and neuroscience I mentioned before. We look at ethics, utilized during sessions, very important given boundary issues while people are in a vulnerable state and altered. We talk about the history of the research. We then talk about the historical use of these medicines in sacramental ways and for use in wisdom traditions across the planet. We then talk about their value for developing community and a sense of wellness. And we have people with an anthropological background come in and talk about its use in shamanism. As you can see, that's only 15 hours of the 180. I had to make a choice about that. This is not my personal choice of what I would prefer, but right now we're training people to be primarily researchers. I think we may do more of this after a couple years when we can open up the discourse. And here's another great quote from William James. I have no doubt whatever that most people live, whether physically, intellectually, or morally, in a very restricted circle of their potential being. They make use of a very small portion of their possible consciousness, much like people who, out of their whole bodily organism, should get into a habit of using only one's little finger. We all have reservoirs of life to draw upon, of which we do not dream. That might have been true of most of us in this room, but after our first psychedelic experiences, we probably dreamt away and knew a lot about what that last line meant. I can tell you a couple stories if I had time, but I don't. But several of the psychiatrists and several of the clinical psychologists told me that they were tired of working with people writing scripts for SSRIs. They were tired of doing CBT. They weren't seeing results. They had been thinking of leaving the field. And several people came out of retirement in their 70s to be in the certificate program, and 2 of them have already renewed their licenses in prep for doing this work. It's very heartening to see people make such life choices. So here's our 3rd module. This is the meat of what we teach. It's the competencies, what the healing presence is for this kind of work. You've heard a lot about that already in the conference so far. How to help people make meaning of what they're doing and set their intentions. Safety issues, how to recognize acute distress. Adverse events have been practically nil in the research, both here and in the United States, which is wonderful. It means we've been doing our work right. And then we teach people to do integration in the aftermath of the sessions. And this is our it's really funny to follow Iker. We're actually doing holotropic breathwork training with our students to help them have an altered state and to sit for one another and practice as guides. We've done through many of us, there's probably 5 or 6 of us who taught last year who utilized varieties of expressive artwork, self-hypnosis training, guided imagery as part of the induction of an altered state. We had 2 traditional teachers come in, one of whom did a drumming circle and one did a rattling circle, and people wrote about that afterwards, their experience of both of those types of work. And we have in the plan, we have a protocol that we're looking for funding for so that the therapists can all have 1 dose of psilocybin and one of MDMA blinded in a crossover study. And I'll credit Rick Doblin for having given us the idea first. My president jumped out of his chair when that was first proposed to him, saying, my students can't have drugs. But he came around. And now the university is supporting us in doing the work to get the money so that the students would sit for each other. They'd all be able to talk publicly about what the experience of psilocybin and MDMA are. And I'm using those 2 because those are the likely candidates for rescheduling. And they can talk publicly about what it's like. And they'll know what it's like if they don't already. Chances are they know already, but they will know the protocol. All the literature suggests to have therapists in training know the protocol by which they will be utilizing the medication. It's a different experience. And just to let you know, I'm coming toward the end, lest you feel like Billy, who the deal here is Dad's telling Billy how the path of balls accentuate the arc into the window. And Billy says, I came to dread my father's lectures over all forms of punishment. I'm almost done. So, Module 5. This is where we have collaborated with MAPS and they with us to spend a week with Michael and Annie Mithofer. Are you familiar with them? Have you seen them? Have they presented here yet? Oh, I hope you could get them sooner than later. They're wonderful teachers. So we spend a week with them looking at their archival films and they pause, they tell us why they did what they did, they offer critique of what they did and what they would have done instead. It's very enlightening to watch them do that. And then we also do role play where we enact actual sessions with the help of various teachers. Whoever is the wannabe therapist and the participant and an observer, everyone has a script and the other 2 don't know what their role will be. So it's all spontaneous and unpredictable and very clearly coming from a session that one of the teachers has observed. The students really like that as a teaching modality. Here's another quote for Albert Einstein that I hold dear in this particular program. I am enough of an artist to draw freely upon my imagination. Imagination is more important than knowledge. Knowledge is limited. Imagination circles the world. As far as we know, Einstein was never able to avail himself of a psychedelic, but I know for sure he understood mystical states based on his writings. So this is a parameter that I hope the students will work from. They need knowledge, but they also need the capacity of not knowing, or from a Zen point of view, staying in beginner's mind. And then from Thomas Merton, the theologian, the ultimate cure, as many ancient and modern psychologies of depth have asserted, comes from love and not from logic. Many researchers, if they are given a sense of safety, will talk about the fact that what they see emerge in sessions often has a quality of love to it that may not be explainable, is not explainable, but categorically, it appears as if the person has experienced compassion for themselves and the other and the world itself, and the therapists are feeling it at the same time. So I don't know what that has to do with the work that we're doing, but I know our planet needs more of whatever that is. And part of why I'm standing up here and doing this work is I'd like to see more of that quality on this planet, and I believe this work is going to help it, or at least we'll go down together doing something well and something good. I have come into the right room. I can tell. There's agreement here. Let's all be conspirators together. So module 6, this is something I'm very proud of. I was a dean of faculty for 5 years at the university, and I saw our students get highly developed once they had a good mentor. So we have mentors to match up with each of the students that we have culled from our teachers. They speak with a student once a month on Zoom if the teacher's here in Europe or on the other side of the country, or they meet each other in person and they talk about professional development, what other readings the student should do, what other experiential workshops the student should take in order to hone in on their best chance at getting hired when things open up. And then we have them do volunteer work, and I have a friend who introduced me to, probably he's close to 90, underground therapist who taught with, spoke with, and worked with Leo Zeff. People know the Secret Chief. Worked with him for decades, and well, at least a decade and a half, I just exaggerated, 15 years. And he recommended you should teach these people to do selfless service because this is not a field in which they will make money. And I knew that to be true. It's not. People often doing this work, as the researchers, the chemists, and the therapists are making like very, very little. It's dedication and self-sacrifice. So he said add in volunteer work, even if they've done a lot of it, hold it up as a threshold event that they should experience. If they're in their 60s, they probably haven't done it in a while, but I asked my students who graduated last year, should I let go of that because I was uncertain? And they said, no, we loved it. We loved it. They went and volunteered in hospices and ERs. They volunteered in dual diagnosis inpatient units in which they had a connection. Or if they had done a lot of volunteer work and had been with people in altered states quite a bit because of the work that they did. We had some people who'd been on critical response teams and lots of psychiatric work in inpatient units. They then went and got training doing holotropic breath work, or guided imagery training, or internal family systems training to augment what they already had. And my students said they really wanted to keep that in, and I think it adds in an individualized aspect to the study for them. And this is our outcome. We had a really detailed admission process, which Bill Richards helped us develop, which was an hour interview and lots of questions getting at, had they ever been through a dark night of the soul? Had they ever had an altered state? They weren't being recorded, so we asked them, if you feel comfortable, could you tell me about any psychedelic experience you had in the past? You don't tell me where you had it, but did you run into some rough spots, and how did you deal with it? And then secondly, who did you reach out to for help, and how open were you to that help? And what was that whole process like for you? Because we wanted the people who had had trouble already. We wanted people with some depth. And I think because we only had one person drop out and it was for financial reasons, the rest we graduated. I think we're doing really well so far in our admission criteria. The students were 5 of them didn't want their colleagues to know they were in the program. These were people at UCSF, University of California at San Francisco, or high-level administrators in local insurance organizations in our Bay Area. By the end of the program, all of them had gone to their colleagues and said, this program is really good, you should learn to do this, this will help our patients. It's really interesting. They felt like they were coming out of the closet, and they were delighted to meet one another. So they loved the fact that community was created. And they're meeting every other week on Zoom now, or GoToMeeting. They're meeting with one another. And then I had many more renowned and wonderful instructors than we had room for, and as teachers. And the president, our donors, the faculty, and our board of trustees have totally supported this. My university took a big risk on me and the program, and I'm really glad that they did. And it's unusual. We're the first university ever to approve such a program from the 50s onward, as far as I know, at least in the English-speaking universities. I haven't heard of any other on any other continents. And then lastly, that we have 8 grads who are already working with MAPS and Hefter. And I share this with people coming and inquiring about the program from Turgenev. If we wait for the moment when absolutely everything is ready, we shall never begin. So in some ways I began this 2 to 3 years early, but I know if all goes well with Hefter and Beckley and what Compass Pathways and MAPS are doing, we will need we will need thousands of therapists. So we are early, but we're late at the same time. And I'm really glad to present this to you. And we have maybe 2 minutes for questions. One question. Well, actually, or do you want to do it as a panel?
1 second. Does anyone know where Richard Miller is, or whether Richard Miller is here? Because if he's not, and it seems like he's not, then I think we're going to do Q&A for the 3 presenters. If you guys all want to come up here, we'll do Q&A together.